Thank you. As always, we're joined by Dr. Syed Hussain from Trinity Health in New England, who's still giving me the side eye because he can tell my voice is not 100% fine. Wondering what virus I got that a lot of you are getting. And boy, a lot of you are getting the flu. You were telling me before, first of all, good to see you physically.
Yeah, likewise. Glad you're back.
To have you here.
And voice is coming back.
Voice is finally coming back, yes. This flu season has been a doozy. Where can we put that in terms of historical perspective?
Yeah, this is per the CDC, Tim, this is the worst in terms of flu numbers we're seeing since the 2009 swine flu pandemic. So this is second wave we're seeing basically, and it's mostly driven by influenza. The other two respiratory viruses that we always keep an eye on, COVID-19 and RSV, they're both on a downward trajectory, which is great, but it's influenza that's causing most of the illness across the country. Most states around the nation are high to very high, including our region here. There are 15 states that are showing an upward trend, whereas the rest of the country is showing a slightly downward trajectory in terms of new flu cases that are popping up. A lot of children being impacted. We've also seen this coincides with low vaccination rates.
Yes.
Both in adults, there might be some vaccine hesitancy that is in play, but also in children. This is the lowest the numbers of vaccination in children we're seeing in 6 years.
And I'm wondering if it's sort of saying that a lot of kids are being infected. That also brings me back to 2009, where a lot of younger people were getting infected, as older people actually probably had some pre-existing immunity from a previous swine flu pandemic even before then. And yet, here we go, the kids are getting hit. So, of course, as always, what can people do at this point just to make sure they're not getting it? Because when people are getting it, they are just staying sick for weeks.
So vaccination?
Yes.
Okay, even though it's pretty late in the season, but that's number one. Even if you've had a bout of flu. Number two, it's the basic hygiene precautions. Wash your hands. Wear a mask if you're in a crowded indoor situation, for instance.
Yes.
Wipe surfaces with a disinfectant. Don't touch your hands, your eyes, or your mouth with your hands, especially if you've been outdoors and touched other surfaces. So, and when you do wash your hands, make sure it's either with a hand sanitizer or at least for 20 seconds or longer with water and soap.
Yes. Yeah,
basic precautions that we need to all take.
It's amazing how the water and soap always just works, right? It doesn't necessarily kill everything. It just literally removes it from your hand.
And then if you do fall sick, stay home.
Yes.
And make sure that you reach out to your healthcare provider to see if you're eligible for Tamiflu, for instance, if you do test positive for influenza.
Okay. All right. Now, another medical problem that just sort of popped up before we go. We've been reporting on this. Congressman John Larson had a medical episode on the House floor this week. He was speaking and then briefly froze mid-speech as if he was trying to find his words, but seemed stiff. And then when he started speaking again, the speech sounded labored. It sounded like he knew what words he wanted to say, but was having trouble saying them. Well, his office revealed that he had a complex partial seizure that could be the side effect of new medication. He also mentioned that he had a heart valve problem taken care of 15 years ago that it might be related to. So how can we sort of put this into a
so what is this condition? So a complex partial seizure is basically because of a surge in electrical activity, Tim, in parts of the brain. And that could lead to certain symptoms that we saw on TV, for instance, including just dazing out and just not paying attention, just freezing for a second, repetitive movements, blinking, eye blinking, or twitching. It can last from 30 seconds to 2 minutes, and there could be some confusion after the episode resolves. It could be related to medications, but there are other things that folks need to get worked up for. It could be psychological stress, emotional triggers to cause a complex partial seizure. And sometimes it's associated with brain condition, heart conditions. So suffice to say, there's treatment options, but there needs to be a workup.
Is there anything that we can take from the complex or the partial, what those mean in the context of the seizure?
Yeah, complex usually leads to confusion, whereas a partial is just relegated to one side of the brain. A complex may involve multiple parts of the brain, which then will manifest differently when a person is having that seizure.
It sounds like these are transient. Can they sometimes be a harbinger of another bigger health problem?
It could be. Great question. So complex partial seizure is the most common type of seizure in epilepsy, for instance, also associated with cerebral palsy, brain tumors, brain injury, heart conditions, but epilepsy is number one.
Okay. Well, thank you so much. And, of course, we wish Congressman Larson well. He has worked so hard for our State of the Years. We wish him well. And thank you for giving us the lowdown, because I knew nothing about complex partial seizures. Now we know something. Thank you.